Hi, my name is Shelby Bates, and today I'm going to be going over Pemphigus bullicus. I created this PowerPoint with my fellow classmates Alexis and Trini. Pemphigus is one of the most common immune-mediated skin diseases that we see in dogs and cats. Typically, you're most commonly going to see in cats. The animal's immune cells will stop working to identify, the body's normal healthy cells from foreign invaders, and they start to attack the normal cells. With this disease, the animal's antibodies, autoantibodies, so the proteins in the skin start to break down, and the substance that bonds the epithelial cells together, most commonly found in young and middle-aged female dogs. Although personally, I have seen it probably more in cats. It is not as something that I've commonly seen, but it is something that I have seen in cats before, more so than dogs. Causes for pemphigus, there's 3 possible factors that they can be linked to. So your internal factors, your external factors, and some unknown reasons as well. Your internal factors can be anywhere from dog breed, genetic predisposition, underlying medical condition like skin allergies or cancer. Your external factors, these are typically going to be ones that can cause unusual inflammation, so your viral infections, UV light exposure, and drug-related reactions. Clinical signs of pemphigus include, and they can be characterized by hair loss, blisters, pus-filled spot, widespread thick crusting of the skin. Figure 4 here with the crusting on the ears. I've seen severe cases of that on cats. And the crusting here on the nose on figure 6, I've seen same similarities of that, but more severe on the ear of a cat. So these are typical signs that you would see in a patient that has pemphigus. Typically, you're going to have that loss of some or all of the epidermis and scabs and ulcers around eyes, ears, foot pads, groin, and the bridge of the nose. Rarely found around the mouth or any other areas where there's mucocutaneous junctions. This can help differentiate between Pemphigus bullicus and Pemphigus vulgaris. Pemphigus vulgaris is a more rare form. Diagnosis of pemphigus is based on your history and clinical signs. There are diagnostics and supportive histopathologies that you can perform as well. Specific diagnostics you can perform would be a skin biopsy, even cultures and cytologies of those areas. Your most definitive is going to be a skin biopsy, actually using this skin punch here in the picture to actually take a piece of that affected area where you're seeing those definitive crusts and sending that off for sampling. Cytologies you can do as well. You can use these to get a sample of those pustules or crusts and stain it, and you're going to be looking for acantholytic cells under the lowest power. And again, your skin biopsy, you use the biopsy punch on those affected areas. You're more likely going to have these patients sedated or anesthetized to perform this. And it is ideal to have done before any steroid treatment because steroids can disguise the disease as well. Primary treatments for pemphigus include typically your steroids is going to be what you most typically will use. There's no set protocol for the treatment of pemphigus. Medications and dosages may be tailored to each patient and the severity of the disease, signs, and efficacy of the medications. But again, glucocorticoids, they do provide the most rapid response in dogs and cats. And now you can use long-acting injectable glucocorticoids, but they're not recommended as it's difficult to adjust the dose. There are supportive treatments. So initially you're going to probably see patients that will present for this. They'll be put on steroids, and you don't want to keep them on steroids long term. Obviously, it's going to have adverse effects. So typically you will see patients that will be on long-term cyclosporin medications. They can even be in conjunction with that, but most of them are long-term on the cyclosporin. So again, other medications in conjunction with glucocorticoids, so azathioprine, cyclosporin, tetracycline, or niacinamide can be used. Azathioprine is contraindicated in cats, so leucovorin and cyclosporin are preferred for them. And then you're going to have systemic antibiotics should be considered if there is a secondary bacterial infection. So your topical treatments are going to be in your more mild cases or specific, just one general area. So topical steroids without any additional medication. Now your more severe cases, you can use topical glucocorticoids to decrease the amount of systemic immunosuppressive therapy. Topical therapy isn't used for cats, and it is more difficult to apply topical medications to cats. There is no concern for zoonotic potential with pemphigus. It does not easily contractable between, humans can't get it, other animals can't get it. It's more of a immune disease specific to that patient. Prognosis for pemphigus is guarded and can be variable. You may see resolution after 6 weeks to 6 months. Obviously, your long-term use of steroids can ultimately cause other adverse effects. So that's why sticking away from long-term use of the steroids is best. You also can have secondary infections, which can prolong, resolution as well. But pemphigus also is very prone to improving and then returning as well. So in detail, we have gone over pemphigus, foliaceus, which is the most common immune-mediated skin disease seen in dogs and cats.